Carlos.
Hi, Mary.
Today is November 13th, and it's almost about, probably about 6 weeks since we last saw one another. And in September, you had done some formal speech therapy for your speech and voice symptoms related to Parkinson's. And you've had Parkinson's how long?
Since 2002.
Okay, and you're a retired physician.
Exactly.
And I know that when we worked together in September, you were bothered by some changes in your voice and your speech. And so, did you feel that by the end of therapy you had made some improvement?
Yes, I've made some improvement. I've been able to talk better with the people and not to feel so shy.
Good, okay. And one of the things that we did together while we were still doing formal therapy, and then that I left with you, were the Voice Aerobics DVD, which is an exercise program, and the CD, which is a more voice exercise. And I know you enjoyed doing that because you used to be a singer, correct?
Correct.
You sang in a band, is that right?
Yes, I sing in a band.
Yeah, I heard that was how you put your way through medical school.
Yes, I have to a little bit.
All right, so, and one of the things that I noticed when you were doing the Voice Aerobics Songbirds exercises is that you had more movement in your face, maybe a little bit less stiffness from the Parkinson's.
Yes, I noticed I have more expression.
More expression, yeah, great. So is there any particular track that you enjoy doing the most, or?
Yes, I enjoy doing the I-O.
Okay, the Happy Vowel Trails.
Happy Vowel Trail.
All right.
I enjoy doing the track number 5, the BB, Bobby Poo.
Oh, okay, that real fast one. So would you do a little bit for me? All right, so I'm going to pause the tape recorder for a moment and we'll get it set. O and U. Be sure your mouth, jaw, and tongue are relaxed and feel the support of your breath powering your voice. Your turn. Great, your mouth is nice and open. Voice sounds strong. Great. So keep that expression and exaggerate those movements. I-E-I-O-U. Ready?
I-E-I-O-U.
Sound great.
I-E-I-O-U. I-E-I-O-U. I-O-U. I-E-I-O-U.
Great. Stay loud.
I-E-I-O-U. I-E-I-O-U.
Nice. Happy trails.
Bobby Poo. Bee Bobby Poo.
Good. Stay loud.
Bee Bobby Poo. Bee Bobby Poo. Bee, 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 ba, bee, bee, boo.
P Poppy, lips together.
Beep, bop, beep, beep, bop, beep, beep.
Good, exaggerate the movements.
Beep, bop, beep, beep, bop, beep, beep.
Let me see all your teeth.
Beep, bop, beep, beep, bop, beep, beep.
Great.
Beep, bop, beep, beep, bop, beep, beep. Beep, bop, beep, beep, bop, beep, beep. Beep, bop, beep, beep, bop, beep, beep.
Diodokinesis is a measurement that speech pathologists use to judge health. All right, now this is a challenging one, right? Yes, it makes you go very fast. Okay. Pa,
Ka,
ta, and ka. So your lips and tongue are going to be moving quickly. To say pataka.
pataka.
To a Latin rhythm.
You ready?
Join me in a tango. Make sure you take a good breath. Go. Now the T. Ta. Now the K. Ka. All right, be brave. Put them together. Pataka, pataka, pataka.